Hi, Dr. Amanda Lynn here, naturopathic physician focused on Marvan Syndrome, hyperflexible spectrum disorders, including Ehlers-Danlos syndrome. And I want to talk about some concerns for those who are thinking of getting their vaccine here in February 2021 and might need to do a couple checks first before you go in and get your vaccine. I am definitely here to help just present information. This is not medical advice. Please see your physicians beforehand, but I am excited to be a physician that will still be able to give you information, and I don't have an agenda. I'm not getting paid by anybody. I am just looking through the other physicians that have concerns that have been stopped either by the FDA, Pfizer's experts, in regards to some of the safety things that we need to be sharing with the public so we don't have this backlash of everybody not trusting pharma. I personally don't trust big pharma, but I have been in this world for over 20 years. And this is why I became, well, even longer, but it's med school and 12 years of medical practice. So over 20 years. But as a patient, 40, and was immediately kind of turned off with the side effects and it not getting to the real reason and source of the root cause of my problems. Most of the things being fairly toxic to us anyway, right? And knowing that there has to be nutrients and food and things that are going on that way that we can make changes for, especially when we're seeing nutrition isn't even taught but a weekend course to most of the physicians out there. So I am working on a big, huge thing on the ethics and biotechnology, and it really started way back with the AMA shutting down over 250 naturopathic homeopathic schools in the late 1800s and beginning the AMA because we were really excited about penicillin and winning the war, and we thought drugs were the answer. We don't need those midwives, chiropractors, naturopaths, eclectic nerds learning Native American herbs. They were schools that took in African Americans, Indians, women way before that was cool because it was the medicine of the people. So I'm really excited as a naturopathic revolutionist to start seeing people turning to alternative medicine for answers, because this was the heart of our medicine in this country. And we are all starting to see the lies and the poor health that all of these pharmaceuticals are doing to us. We are the richest country and the poorest in health, and this is becoming really evident now, right? So, with that being said, I will get to some of my concerns here for frail cardiovascular patients. And this was specifically coming from a pathologist who had reached out to the FDA and Pfizer and didn't get pushed through. But his concerns are for those who are getting over COVID or are asymptomatic, and if it is going to be hanging out in the arteries when you get a vaccine. You're getting more of this COVID, you're getting stimulated to have COVID, and you're actually telling your body how to kind of make COVID with the mRNA, new biologic. So this is why we're seeing some really extreme reactions with over 650 deaths, and those are just the ones that are caught. Bayer system is renowned for not catching everything because people don't even know about it, that you're supposed to report it, or people blow it off as coincidences, which some are, and or things just not being connected because it's sometime later. Luckily, most people are fairly aware, realizing this is experimental, it's not a vaccine, and so hopefully reporting will be a little bit more accurate. So far, not so much. And unfortunately, some of these things are going to be a little bit later that we realize just because of the nature of this vaccine being a biologic, being something that is working in there a little deeper. And we'll talk more about that with, I get to the Ehlers-Danlos. So Dr. Norchasm, I'll get that eventually. He has a total point where the COVID is in there and you get a shot and it kicks up and boom, now you have clots forming, get thrown, too many at once, and then we're seeing some really dangerous things happening, and immediate death for some of these people responding. Yes, there's always vaccine reactions. Wonder why. They haven't ever had to really look at that and improve their vaccines since they don't get in trouble for anything that they do. We, as the people, pay for all that. It's not the case in Europe, and they do have some cleaner vaccines, but they still are trying to give like 6 at a time, which is way overwhelming for the immune system. Anyway, back to Marvan Syndrome. We have a whole different pathology going on in our arteries. We're eating ourselves up constantly on the muscle side, so we have tons of scar tissue, and we're looser connective tissue, right? More things, we found bacteria get in these areas and can be harder to get out of our tissue, being so loose, so many hiding places. So corona can get in a little bit deeper into our intima, and it's more messed up with scar tissue being the basis of it, right? This is why we rip here at the aortic arch. It's just too weak with pressure and it rips. So you definitely want to make sure you feel confident that you don't have any lingering COVID in you before you get your vaccine. And 2, if you are on any blood thinner, it's Eliquis, Coumadin, warfarin, check your INR, make sure you're in a good place before you get the vaccine. Because any injection, I don't care if it's my regenerative dextrose injections, just your INR is off, you can have reactions. If you're too thick, you will more likely have a possibility of getting clots. Or if you're too thin, you're going to bruise, because they are bruising people pretty good who don't have a blood thinner in their system. I use Arnica for all bruising. It's a miracle, homeopathically, and you can get 30C usually over the counter. You just have to dose it a little bit more, but that's what I do. It's not medical advice for you. Ehlers-Danlos, you guys are autoimmune, right? We're kind of changing over your ideology here to looking like it's from a histamine receptor, autoimmunity being a big culprit here. So autoimmunity's always been something, even in the MMR insert from the CDC, says this can possibly cause autoimmunity. If you have autoimmunity, you might want to stay away from this. Now, that's what is on many of these vaccines warnings, but right now they want everybody getting this. I don't know why, when the chief medical officer of Moderna has said, I don't believe this is going to stop the spread or create herd immunity. And we can go into that because this is why there's no vaccine to the common cold. If you have researched corona, that's where it's coming from. So EDS, autoimmunity, if you're concerned at all about triggering yourself a little bit more, you might want to wait on this. Especially if it's just reducing severity, not going to prevent you from passing it along to your elderly friends, family members, loved ones, or little babies and such too. For the most part, we are just seeing kids come through this like crazy. They're not super spreaders because they don't have heavy particles in their breath. So hopefully the kids can remove the masks. I just don't find that helpful at all, to be muzzling our children to not breathe. All right. For the most part, that's about it for now. Until I find more research I need to share with you, please subscribe down below or hit me up over at dramandalyn.com so you can be the first to get my new book out on how to live with these loose connective tissue disorders. Well, you guys take care, and look forward to sharing more soon.